Hi, I'm Dr. Fritz Sutter. I'm just catching up with my patients, and we'll be doing an e-blast along with this as well to let you know what's going on here during the COVID-19 pandemic. We are still seeing patients. We're trying to keep more acute issues out of the emergency room. So if you have a fall or a mishap or a flare-up of your pain, we can see you. We are taking extra special precautions. There's no waiting room. We take you right back into the exam room. We're screening everybody, and if anybody has a fever or a recent exposure, we do not see them. We take everybody's temperature before seeing them. We wear gloves and masks. I don't have my mask on now, but I just got done seeing patients with the mask and gloves on. A couple things to update you, to fine-tune your hygiene issues, flatten the curve, as they say. A few very important things other than the hand washing, the 20-second hand washing technique, is to keep your forearms bare like this. Many of you have known me. I've been working with bare forearms for a long time, and that now includes watches and bracelets because they are typically, as well as cuffs, are forms of contamination, and it will not allow you to wash your hands and forearms better. So that's a good thing to do, is just get all the bling off the wrists now. The second thing would be wipe down your phone. Everybody washes their hands and then they pick their phone right back up. So alcohol, 60+% will work for that. Sometimes even a quick wipe with your paper towel that you dried your hands off with to wipe your phone down, because we unconsciously use our phones all the time, like all the other things that are in our life that we now need to become more conscious of. So please, and the other thing too is if you have ongoing medical issues and you're afraid of trying some of the supplements we've talked about before with immune support, please call our office. We are here. We can do a video conference or a telemedicine or an e-visit, whatever they have to make up their mind what they're going to call it now. But we are happy to speak with you by phone. A reminder that we are shipping any supplements free of charge at this point, so people don't have to come in. And you can also get them online. Unfortunately, vitamin C is back ordered everywhere on the planet, which is one of the mainstays that we use. I like to see somewhere between 1,000 and 2,000 milligrams a day. Most of our patients were using 750 milligrams of a buffered vitamin C a day. Vitamin D is very, very important because it actually modulates the inflammation response. Inflammation is what creates the biggest issue in the COVID disease. So the COVID exposure and subsequent disease. So the most important thing is if you are low, make sure you're taking your vitamin D. If you're not low, the upper limit of tolerability is about 4,000 units a day. And I like to split that morning and evening with 2,000 in the morning and 2,000 in the evening. It's just important to help with the inflammatory response. We don't know why some people react and some people do not. And we can't really speculate at this point, but reviewing the supplements that I've been in contact with multiple colleagues and I've been reading voraciously to see what can work at our level. I don't think we all want to wait for, heroic measures in the ICU to prevent this as much as possible. And I think there are things that are meaningful that people can actively do in addition to the hygiene to help their immune system. Vitamin A is hasn't been forgotten, but we don't use it very much. But some colleagues are suggesting that we use that because vitamin A maintains your epithelial borders and your integrity of your epithelium. And those are the cells that are the first line of defense against the organism. So taking about 10,000 IU or 3,000 micrograms of vitamin A day is the upper limit of tolerability and is very, very safe. So I think this would be an additionally good preventive measure. Now, of course, if you're vitamin A deficient, which we don't test so much, that would be a different story. You must take a lot more, just like if you're vitamin D deficient, you'd be taking a lot more vitamin D. Next is a probiotic. I feel strongly that that army of organisms in your GI tract plays an amazing role in managing your immunity. I know in one of the textbook chapters that I authored last year is that if you take a probiotic for 10 days before an elective surgical procedure, you will have 50% less likelihood of any complication just because of that one variable. Obviously, it's making a difference for infection as well as inflammatory response. So this probiotic is not something to just use for your irritable bowel syndrome. It's very, very important in manning your immune system in a way to prepare it for any challenges, particularly in this pandemic line. Immune support, we talked about this before, and we will provide a link to our previous immune video, which is a wonderful and remarkable and very well tolerated product, derivative of Saccharomyces boulardii, another probiotic that creates an immune response in the gut that actually is a feed forward. So if you miss a day, you don't have to worry about, having it not work. Vitamin C, you have to be very consistent with that. Probiotic, not as much, but maybe a couple days you can get away without it. But this one will last a few more days. It's twice a day. It's our typical dose on that. Next product we've been using is a product called Monolaurin. It is a derivative of coconut oil. Coconut oil has a essential component as one of its oils is called lauric acid. Now, it's not like an acid that you're thinking of. This is a fatty acid. And this has been shown to be virucidal, which means it kills the virus. They've used it topically for many years for many different conditions, but it hasn't had a lot of traction in the media. But I would say that this is a very important component and addition and very well tolerated product. So not only is it giving you healthy fats in your diet, but it's also supporting your immune system in many different ways. The usual dose of this is it comes in little beads, and you take a scoop in the morning and a scoop in the evening. Usually you work your way up on that, not to be, don't get too aggressive with it right away, because some people don't tolerate the fat so well. If you don't have a gallbladder, you might have a little problem with that. So just to review, we talked about the hygiene. We are available. My staff would be happy to talk to you. We can set up an e-visit if things are a little bit more complicated, or telemedicine visit. And we are shipping free of charge for your supplements if you need that, so don't worry about that, so you don't have to go out. And I look forward to checking in with you in another week as I stay in contact with my colleagues and continue to practice here in the office, helping people stay out of the emergency room and help them manage their pain. Thanks for listening, and take care of all of yourselves. Thank you.